Good morning and happy Monday. My name is Melanie Garland, and I am the Southwest Volunteer as supervisor. Goodness. I need a little bit more coffee this morning, apparently. But thank you for joining us this morning. And I've got my two lovely co-hosts with me, Megan and Susan. So we are all over the state today, but connected here for our Facebook Live presentation. And we are so happy to be presenting the topic that we have planned for you today. So we know that when we think of medications covered by Medicare, we mostly think of our Part D plans. And we just came out of the open enrollment period at the end of the year, and we're still in the middle of the Advantage Plan open enrollment period where you can make some changes to your drug coverage. But we're going to talk about sometimes what happens when your medications and why they may not be covered by Part D. So Megan has prepared a wonderful presentation for us this morning. So Megan, I'm going to let you dive into it. And ladies, I hope you're doing well. And thanks to everyone that's viewing in so far this morning. And before we dive right into our presentation, just a reminder that these presentations are presented in live format, but they are saved to our page for later viewing. And while we are presenting, if you have any questions for Megan, please go ahead and type them in the comment section, and we will be monitoring that, and we'll do our best to give you some live responses. All right, take it away, Megan.
Thank you, Melanie. All right, so let's dive in to our medication and Medicare. So we are going to talk about what Medicare Part D covers. Then we're going to talk about when Part D doesn't cover it and the other parts do. And we'll also have a conversation about ways to save money with your prescriptions, because sometimes our prescriptions can get a little pricey. Medicare generally doesn't cover your medication at 100%. So we'll talk about ways to save some money or some other options. So Part D is our standalone prescription medication part of Medicare. We have Part A, which is our inpatient hospital. We have Part B, which is our outpatient. Part D is our medication. And then for those that have an Advantage plan, that's also called a Part C, and that bundles your A and your B and generally your Part D. So everything we talk about today, when I talk about Part D, we're also talking about those Advantage plans as well. So it's either your standalone Part D or your Advantage plan with Part D drug coverage. Now, usually when you do have a Part D plan, there's usually premiums. There's at least one plan in Indiana right now that doesn't have a premium, but all of the other plans do. Depending on the medicine you're on, you're probably going to have copays. Some medicine, specifically tier 1 generic, will sometimes be a $0 copay. However, there's a fair amount of medicine that will have some copays. And then you may have a deductible depending on what plan you have. So the deductible this year, 2025, is $590, I believe. Ladies, correct me if I'm wrong with that one. Still learning the 2025 numbers. So one thing to note, and I am one to admit that I was very confused about this for a while. I did not understand this, but the deductible doesn't apply to all your medicine. It only applies to tier 3 and higher medicine. So if the plan does have a deductible, it could be a $0 deductible. It could be a $100 deductible. Some plans have $300. The most they'll charge for your deductible is $590 this year. And that's only going to apply to tier 3 or higher medicine. So if you're on tier 1 or tier 2, that deductible that your plan may have does not apply. But it's important to know that it's in the background, because if your doctor prescribed you a brand name tier 3 or higher medicine, when you go to the pharmacy, you may be told that you've got to pay $200, $300, $590, and that's your deductible. And then once the deductible is met, then you'll just have those copays that are associated to your medicine. And most Advantage plans, they do have copays, they do have deductibles for your medicine. However, most Advantage plans do not have premiums, though there are some that do, $18, $24. Usually, at least for the ones I've seen, it's under $50 a month. And that might fluctuate depending on what part of the state you're in. You are going to have your pick for the most part of pharmacies. You can either do a mail order option, Optum Rx, Express Scripts, those are the popular ones, or you can go to a brick and mortar retail pharmacy. And we're going to talk more about pharmacies a little bit later when we talk about ways to save money. So we'll talk about those throughout. And then new this year is one, the donut hole has gone away. And the donut hole is where you generally have had to pay a higher copay for your medicine if you've reached a certain amount throughout the year. This year, the donut hole has gone bye-bye, and the most that someone would pay out of pocket has gone down to $2,000. Now, it doesn't mean you're going to pay that amount, but if you're on a lot of medicine or a lot of expensive medicine, that is the most that you'll pay. So that's a very good. All right, so now that we've talked a little bit about Part D medication and some history and how it kind of works, let's talk about when Part D doesn't cover your medicine. Sometimes your Part A or your Part B will take over covering some of your medicine. And it's mainly going to depend on your medical setting and your medical necessity. So let's discuss. So Part A, again, is our inpatient. So Part A covers when you're admitted to the hospital, when you're in the nursing home for rehab, or you have hospice care. So if you are in any of those settings, then Part A is going to take over your medicine. So the medication you get when you're in the hospital admitted will be bundled in to your hospital bill. When you're at the nursing home for rehab, the medicine that you get from the nurse there will also be bundled into your copay amount that you may have to pay for nursing home care. And then if you have hospice care, now you could have hospice care in your home, you could have it at the hospital in some circumstances, you can have it at the nursing home, or you may go to what's called a hospice house. And not all hospices have a hospice house, but you may go there for respite if your caregiver needs a break, or if you or your loved one is actively passing, you might be at that kind of setting. And some of your medicine would be covered by hospice. Not all of your medicine would potentially be covered. They're going to focus on comfort care medicine. So if you may be in the beginning stages of your journey with hospice, you may still be on some of your medicine for depression or high cholesterol or high blood pressure. And at some point, you may choose to stop taking those medicines. But those are the kinds of medicines that hospice would probably not cover. But if you're on pain medicine, if you need anxiety medicine, anything to help with your comfort, hospice is going to manage those and take over the billing for that. So if you have a Medigap or a supplement, when you are in the hospital or the nursing home, or even with hospice, your Part A covered drug costs would be covered by the supplement. So you most likely are not going to have a bill for that, depending on what Medigap package you have, but I believe all Medigap packages cover Part A. If you have an Advantage plan, you would most likely still have some out-of-pocket medication costs, copays, maybe even not so much deductibles, but copays. So that's going to be covered in your Advantage plan, where it tells you how much you're going to pay for hospital, nursing home, or hospice daily copays. Generally, there aren't out-of-pocket costs for copays, but I don't know every single Advantage plan out there, so there is that potential, but there are generally copays when you're in the hospital or nursing home. Skilled nursing facility is the abbreviation for SNF. All right, so now let's talk about Part B. So again, Part B is our outpatient. So doctors, emergency rooms, outpatient hospital tests, all that fun stuff. So if you are getting an injection and you are not doing that injection yourself at home, you are going to a hospital outpatient or you're going to your doctor's office. One of the common ones I see is for women who are on an osteoporosis shot. They tend to get that one at their doctor's office, and that would be covered by Part B. So we'll talk about copays a little bit further in the slide. Um, if you are getting a medication at an infusion center, so generally that's an outpatient setting at a hospital, or maybe you're having home health come in at home and you're getting that medication through a port or an IV, then that is also going to be Part B. If you are getting medication for any of your durable medical equipment, so nebulizers are one of the common ones, or if you have an insulin pump for diabetes, then your medication would be covered through Part B. Now, let's talk about those copays. So again, kind of like Part A, if you have a Medigap/supplement, your out-of-pocket Part D drug costs will be covered by the Medigap. Now, most Medigap packages at the moment do not cover your Part B deductible, and that's $245 this year, ladies. Yeah, I'm getting some nods. I think it was 240 last year, so now I think we're 245, I think. Right, ladies?
The Part B deductible,
Yes.
257.
Oh, okay, I was wrong. It's 257. Thank you, ladies. See, it's still February. It's still early in the year. I haven't learned my numbers yet. So,
You're doing great.
summer, I should have it down. Thank you. Yes. Okay. So 257 is our Part B deductible. And there is no active package of the Medigap that covers the deductible. For those that might still be on Plan F because you were grandfathered in before that went away, the Part B deductible is covered, and C as well. But for all the other packages that are active for everyone right now, Part B deductible is not covered. So at the beginning of the year, you're going to have to meet that deductible, 257, and then once that's met, then you will have no out-of-pocket costs for Part D. So if you're going to get a shot or some infusions at the beginning of the year, you got to pay till you meet that deductible. Once that deductible is met, your Part B will pay first, and then your supplement Medigap will pay secondarily. So you may have some costs at the beginning of the year, but once that deductible is met, it should be paid for if you have a supplement. Now, if you have an Advantage plan, you will have copays, kind of like how it worked with Part A. So it's going to depend on the Advantage plan you have and what your copays might be for, oh, I have a slight boo-boo on my slide. So you want to disregard where it says hospital, nursing home, or hospice, because that's Part A and Part B does not have that. So it would be whatever your copay would be on your Advantage plan for doctor visits and potential out of or outpatient hospital. So if you have a book from your Advantage plan, it might be listed. Otherwise, you can call that Advantage plan to get the specifics for your situation. So there are times that Part B may cover some of your oral medications, your capsules and your tablets. Specifically, cancer medications are generally covered by Part B. There might be some other oral medications that would be, and you would pick those up from your pharmacy. So when you are on Medicare, it would be important that your pharmacy would have all of your insurance cards. So your red, white, and blue Medicare card for your A and B, your Advantage plan card, your Part D card, your supplement card, whatever card you had. If you have Medicaid, if you have any other kind of insurance too, you would want the pharmacy to have that on file because they're going to help you know who to bill when. And it's also important to know if your pharmacy accepts Part B. I believe most pharmacies do. However, you do want to ask that question and make sure they do cover it because then they can bill Part B if you're getting something that would be covered under Part B. And you can always go on to Medicare.gov and you can look to see who are Medicare providers, and you should be able to check pharmacies that way as well. All right, so now let's talk about some medication that is required by law to be covered by Medicare. And these are generally going to be your Part D and potentially Part B, specifically with the cancer medications. So there's 6 protected categories. So you have your cancer medications, you have HIV and AIDS treatments, antidepressants, antipsychotic, anticonvulsive, and immunosuppressants. Now, some of the immunosuppressants may also be covered by Part B as well. And then vaccines are also covered. So Part B has some vaccines and Part D has some vaccines. So Part B, if memory serves me, is flu, pneumonia, COVID, and RSV, I believe. No, RSV might be D. I'm getting some head nods. We think that's D. And then Part B and Part D also both cover tetanus shots. One will cover it if it's just a normal routine update, and the other will cover it if it's an urgent situation. I don't remember which is which, but tetanus shots are covered. So hepatitis are also covered, Part B or Part D. And that's where if you're going to get some of these from your pharmacy, it's also important to have both cards or all cards on file. And again, to make sure that that pharmacy takes Part B for those vaccines. All right.
Megan,
Yes.
this actually happened to a friend of mine who's fairly new to Medicare,
Okay.
and she was upset because her perception was Medicare is no longer covering the flu shot, which she
Oh.
tried to get like she's always gotten at the local drugstore,
Mhm.
which is a huge chain. It was Kroger. And I said, well, I tried to explain to her that some vaccines were under B and some were under D. Flu was under B. So if her drugstore was not a Part B provider, then
Oh.
it's not that Medicare doesn't cover it.
Mhm.
It's that they are not a Part B provider. So that was the question that she needed to ask. And then it was just as easy to just get it at her doctor's visit.
Yep. Yep.
But she
No,
was
that
convinced that Medicare quit paying for flu shots. And it took me a while to get her to understand. So,
No, that's a good story. Thank you for sharing, Susan. And that shows the importance of making sure that you're asking those questions with your pharmacist. And honestly, I get my flu shots from the doctor's office too. It's just kind of easier that way. So you could get it from your doctor's office if you don't want to do the pharmacy. Both are options, just making sure that your pharmacist is covered under Part B is very important. You don't want to assume. And the other thing that I wanted to mention that I remembered when Susan was sharing her story is that Part B vaccines and Part D vaccines are covered at 100% by Medicare, even if you have an Advantage plan. Every once in a while, I'll get a client that calls and says, well, I have an Advantage plan and I had to pay for my vaccine or I had to pay a copay. And I'm like, well, that's not really correct. So let's kind of dive into what's going on with that. And generally, it has just been that the Advantage plan was a little bit confused on the process and they sent a bill by mistake. When in doubt, communication is important. You can contact a ship counselor, you can, talk to your pharmacy, talk to your doctor's office, and or call your plan to find out what their rules are. Okay. So let's talk about some medication that is excluded by law from Medicare. Now, these drugs are excluded for the reasons listed. If you happen to be on these medications, but you're on it for another medical reason, generally they can be covered, but your doctor is going to have to do some advocacy, or the doctor's office, and report why you're taking that medication to the plan. And we're going to talk about some of those fancy terms that you may like step therapy or prior authorization, that you may need some assistance with your doctor. I think that's on the next slide. So just keep in mind, if you're taking some of these drugs for this reason, they're not going to be covered. But if you're taking them for a medical reason, then you just want to make sure you communicate that to your drug plan. So the first is medications for anorexia, weight loss, or weight gain. So the weight loss is a huge thing right now. The biggest drug is Ozempic. And if you are taking that to lose weight, that is not covered by the FDA at the moment to be covered. If you are taking Ozempic for your diabetes, though, it would be covered. But your doctor is going to have to provide that diagnosis to the insurance company to show that it needs to be covered for diabetes. Erectile dysfunction drugs are generally not covered. However, if you're taking it for a prostate issue, I have seen plans cover it. Again, your doctor just has to communicate that to the insurance company. Fertility drugs, cosmetic or lifestyle purpose drugs, medication for coughs and colds are not covered. Prescription vitamins and mineral products and non-prescription drugs are generally not covered. All right, so let's talk about some things that you may have to do to get your medication covered. So the first one is prior authorization. Now, this is something that we generally have to deal with any kind of insurance we have. Medicare, Medicaid, employer insurance, marketplace insurance. Generally, this is a common thing with all kinds of insurances. So this is where, like the Ozempic I mentioned, or the erectile dysfunction drugs, you have to have the doctor reach out to the insurance company and show why you're taking that drug. Are you taking it for weight loss, or are you taking it for diabetes? And generally, if you're taking it for a medical reason, it will generally get approved, but your doctor has to help with that and show that information. And it's important to be aware that that's something you might need to do, because if you need refills, or you need to start that immediately, it could take a few days to get that worked out and to get that prior approval approved. Then we have step therapy. So this is where the insurance company wants you to try something that's generally cheaper before you try something that's a little bit more expensive. And the doctor can request exceptions with this as well. So maybe you've already tried a less expensive drug in the past, or maybe you already know, or your doctor already knows that's not going to work for you because there's something in there that maybe you react to, or you may have an allergy to, or something. So the doctor just has to communicate with the insurance company and say, we've tried this before, we've done this, all of these things, and we've concluded that this is the one that the patient needs to be on. And then we have quantity limits. So you're going to see this more maybe with some mental health medication, or some pain medication, or muscle relaxers, where you can only get a 30-day supply instead of a 90-day supply, or you can only get refills within a few days of when you pick them up before. So just be aware of that. There's some that you can't get as frequently as you may want, or maybe as maybe super early. You have to wait for a couple days before you would be out. And your doctor can step in and ask for exceptions if medically needed. Um, for the longest time, so I'm on gabapentin, which is a nerve pain, and for the longest time, I couldn't get that as a 90-day supply, or at least I didn't think I could. But then I went to the doctor for an annual, and she was doing refills, and she's like, "Oh, do you want your gabapentin sent to your mail order supplier?" And I'm like, "Can I get 90-day supplies?" And she said, "Oh yeah, you can. I just have to put in a special set of ID numbers to approve it." I'm like, "Oh, that's fancy." So, if you're unsure, if you think you can't, but you just want to see, ask your doctor's office and see. Maybe you can. Maybe call the mail order supplier or the pharmacy and see if they know. All right, so now we're going to talk about other options, things to keep in mind, ways to help you maybe save money or get your medication covered if it's not covered by Medicaid or Medicare. So the first one is pharmacies. So when you look for insurance companies for your medication, and specifically if you're working with a ship counselor, we use Medicare.gov. And in this, we can look up to 5 pharmacies. Now, you may not have 5 pharmacies where you live. You may not want to go to or look at 5 pharmacies. But I will say it is important to look at a few, because we're looking at different plans to help you find the cheapest possible plan for you. Well, within that, we can also look to find the cheapest possible pharmacy for you. And sometimes when I put in all 5 pharmacies, there is absolutely no difference with price between those pharmacies. However, there are times that there's huge differences between pharmacies. I may have shared this story before, but I'll share it again. So I was helping a woman and her husband a couple open enrollments ago, and they were going to, I believe, either Walgreens or CVS, and they were on different plans because they take different medicines. So that's another thing. A lot of couples will be on different insurance companies because of the type of medication that they're on. And that's another way to potentially save money. Just don't go with the same plan because you're married. You can have different insurance companies. So I put in her husband's medication and his pharmacy, and the plan that he was currently on was still the cheapest for him. However, we did look at other pharmacies. She did allow me to put in mail order, and she allowed me to put in Walmart, but she said when I did it, she's like, "Well, it's going to have to be a big difference for me to go to Walmart." I said, "I understand. This doesn't tie you into anything. It just gives us an idea if there is a cost difference, and then you can decide." She said, "That's fine." So the same plan that he was currently on was still coming up as the cheapest. But when I looked at the pharmacies, that's when things got interesting. The current pharmacy was about $1,000 a year for the copays. Walmart, 400 for the year for the copays. I told her this, she looked at me and she said, "Well, you know what? I don't like Walmart, but for a savings of $600, I'm going to go to Walmart and I'm going to deal with it." I said, "You go, girl." But again, if I was telling you that and you're like, "No, I still want to go to the pharmacy I go to," that is your choice and that's your right. We are just giving you options and you get to decide. But I would highly encourage everyone to be open to look at different pharmacies, because every insurance company has different pharmacies that they work with. And there's different provider relationships between these insurance companies and the pharmacies. So you've got out of network is one, and that's just how it sounds. There's no coverage for that insurance company at that pharmacy. So you don't want to go there because you'll have to pay 100% retail cost. Then we have in-network. So in-network means there's coverage. However, there's the potential that your copays are probably going to be a little bit higher there. And then we have preferred, and that's generally where you're going to see the cheaper copay amounts with preferred pharmacies. So that's the different provider relationships with pharmacies and insurance companies. And, just remember that it can be helpful to look at different pharmacies to kind of see what works better for you and your medicine. I will say generally from what I've seen, mail order tends to be the cheaper option versus the retail. However, I've seen times where that isn't true. But I've had quite a few clients recently that currently go to retail pharmacies. They're new to Medicare, so they're getting their plans for the first time. They're open to mail order. And the last 5 clients I think I've had, mail order came up as $0 copays versus the retail, which was probably, thinking back on these clients, anywhere from $40 a month to $100 a month. So that's where they kind of have to decide what works for them. And depending on where you live, mail order may not be the best option. I have clients in some very rural areas and they don't want to do mail order because of concerns with their mail, which I completely get. So we're just here to present options to you and you get to decide what works best for you. Now, if you are on medication that is not covered by Medicare, or maybe it's not covered very well, you could look at coupons like GoodRx, or there's Needy Meds. There's several different companies out there. They're not insurance companies. They're just kind of coupons, assistance programs, discount programs, ways to get your medication cheaper. And anyone can use this. Technically, you don't need to sign up for anything, at least with GoodRx. There's been times I've gone to the pharmacy and I've had some insurance snafus, and they're like, oh, well, you can get this through GoodRx for $3 or $12. I'm like, sure, that's cheaper than my insurance. So, and you can use it instead of your Medicare. So if it would be cheaper than what your Medicare copays would be, you could use that instead. Then we have the $2,000 cap with your Part D coverage, and keeping in mind that only drugs that are covered through your insurance company or that you use with your Medicare insurance will count towards that $2,000. If you're going to use GoodRx or another program like that instead of your insurance, Medicare insurance, it won't count toward your $2,000. And if the medication that you take is not covered by the Part D plan, it won't be counted towards the $2,000. So it has to be on the formulary chart for your insurance company to count towards that. Now, there are some manufacturer discount programs. You can work with your doctor's office or even your hospital to see if there's manufacturer programs out there. Some common ones have been to help people with like Ozempic or some expensive heart medication. Dupixent is another one I've seen, and Humira is another one I've seen used through the assistance program, the manufacturer program. And there's different kinds, there's different ways this works. For some, it covers your medicine at 100%. For others, maybe you pay $5 a month or $10 a month. There's one client I work with where she has to pay a certain amount first at the beginning of the year with her Part D insurance for the medication. Once she's paid that amount, then she can get the manufacturer program to pay for the rest of the year. There's also some out there that don't allow you to get the manufacturer program if you're on Medicare or you have a Part D plan. So again, it just kind of depends. Reach out to your doctor's office to see if they know and they can help. Or you can even Google it. So Googling the name of your medicine and manufacturer, and usually some things will pop up. Now, there is a program called Extra Help through Social Security. It is based on your income and your resources. But if you get approved for Extra Help, then it can help pay for your premiums, your deductibles, and it can reduce your co-pays. And this is something SHIP can help with, or you can go on to socialsecurity.gov and find information on Extra Help. And then you can always ask your doctor if there are other alternatives to medication or different options that might be cheaper or might be on your plan's formulary level or formulary tier, to help save you some money. All right, ladies, we got any questions? All right, Susan, you're up.
Well, I would like to point out one of the viewers that has joined us, Monica Griffin. She is the director of the Hoosier RX program. And while it doesn't help, it does not help. Many people think it does, but it does not help with the cost of your medication. It can, if you qualify, help you pay for your monthly Part D premium. So if Hoosier RX helps you pay for your premium, theoretically, that could loosen up some money for you to help meet those drug costs. And I don't know if Monica wants to make some comments, but we can connect you with her. We can provide applications, and there's a really easy online application for Hoosier RX. So keep that program in mind too, along with Extra Help.
Yeah, thank you, Susan. I completely forgot to cover that. Sorry, I appreciate you bringing that up. And we do have Monica come and chat with us at the beginning of the year when the new numbers come out to talk about Hoosier RX. I think we have her we were probably going to have her in March or April. I don't know if we have that date set, but keep your eyes open for Monica Griffin to come chat more about Hoosier RX. So, any other questions, ladies? All right. So, if you would like us to help you look at different plan options, or you have questions about how to save money with your medication, you can contact us. 1-800-452-4800 is our call center in Indy. You can go to our website and find a local SHIP site to where you live. You can also follow us on our social media. And if you're watching this, you already do that. Our videos will be on our Facebook and our YouTube page, and you can always chat in questions after the fact. We do monitor those. So you can chat in the comments, or you can send us a Facebook message, and we would be happy to help you. So I'm going to turn it over to Susan to let us know what is coming up next.
Thanks, Megan, and thanks for all this terrific information. We have something very special coming up this Wednesday, and it is our What to Know Wednesday, and we will be introducing you to several of our wonderful SHIP counselors all around the state, and they're going to talk to us from a counselor perspective on what it's like to be a SHIP counselor and how they, in their own special ways, help Medicare beneficiaries in Indiana. So we like to throw out some extra love this Love Week being Valentine's Day week. And we're thrilled to be able to introduce you to some of our SHIP counselors and learn from them. Then at the end of the month on Medicare Monday, on the 24th, we are going to be doing as they call it these days, a deep dive into the Medicare Prescription Payment Plan, otherwise known as M3P. And this is where you can spread the cost of your medications for the year over a 12-month or less period. And Melanie's going to be telling us all about what that is, how that came about, and how you can investigate it for yourselves to make your drugs more affordable each month. And soon we will be posting our March lineup. So be on the lookout for that on our Facebook page.
All right, thank you everyone for tuning in, and we will see you back here with some of our wonderful volunteers on Wednesday. Everyone have a wonderful, sunny, warmish Monday.